It's my privilege, and I'm thrilled to be speaking about my mentor and friend, Dr. Susan Coupey.
Susan is a leader in the fields of adolescent medicine and pediatric and adolescent gynecology. And if you look at that at the national level, there's so much evidence for that, given her participation as committee chair and presidents of national societies, publication of multiple research papers and chapters in books and even textbooks. When I started my career at Montefiore, I worked with Susan on a project with adolescents who have chronic illness. And what I learned in that work has guided me throughout my entire career.
She led the way in the growth of the Adolescent Medicine Division by not only increasing the number of faculty, increasing our research presence nationally, bringing us into leadership roles in national societies such as the North American Society of Pediatric and Adolescent Gynecology, but really creating programs here, both in the clinical and educational realm, particularly in adolescent gynecology.
The time that I went into medicine, there were very few women in medicine. I had never met a woman medical doctor in my life. I didn't tell anybody that I was interested in medicine because I didn't think they would be supportive. I initially studied biochemistry because I thought it was close to medicine and maybe I could do that. Bit the bullet and applied to medical school and went. I've never regretted it. I've always been extremely happy. When I first went to medical school, I was one of 10 women in a class of 110. It was not a welcoming place for women at the time. I ended up leaving, getting married, having children, and then going back to medical school to finish, because I obviously hadn't finished, almost 10 years later. And by that time, we were 25% women, so it was a completely different experience. Originally, our inpatient unit, we had a dedicated adolescent inpatient unit. We looked after all of the adolescents who were inpatients. The medicine was just incredible. I mean, it was way different and more exciting than anything that I had learned in my residency in Canada.
Dr. Coupey is clearly a leader, and she's clearly someone who embodies what it means to be a clinical educator. She has had a role in presenting and sponsoring fellows, and she just is such a calm and patient educator.
You know, when we go into professors' rounds on Friday mornings, she was always at the table with the other people that I think of as giants in this institution, and hearing the way that you break down a case line by line and the thought processes, the teaching of how to think.
Dr. Coupey is a devoted sort of mother hen of all of her fellows and her faculty. She's really made sure to encourage us to develop both professionally and personally, and has really participated in all aspects of our lives.
What I'm most proud of is all of the fellows that I've trained. I've trained a lot. You know, looking back on my career as a teacher and a mentor, it's given me a family in a sense. I do have my own family too, but this is a much larger and broader family. And really, it's not just the people. I mean, the people that I have trained have gone all over the U.S. and other countries,
I think Dr. Coupey's legacy is really in the numbers and in the numbers of the fellows that she's trained, which has been over 40 fellows who are now spread out across the country. We are so lucky and grateful and privileged to have been taught by you and mentored by you. You are the most important teacher that I've ever had.
I've stayed here at Montefiore my entire career. I have worked other places, but that was before I was a doctor. It's been a very rewarding experience.